This is a friendly reminder that we are here for entertainment purposes only. Check with your healthcare professionals before making any lifestyle or medicine changes. What we're talking about is our clinical experience and what we've seen. You can consult me as a doctor, or you can consult my guest and get all of your questions answered, but we can help to educate you a bit and allow you to think a little differently. Again, always consult your medical professionals before making any lifestyle changes. Thank you.
Welcome back to Cast 11. I'm Megan McClennahan, and back with me today, I've got Brian from Arizona Metabolic Health, our doctor. How's it going?
Great. Thanks for having me back.
You bet.
Appreciate
I'm so happy to have you back. I love doing podcasts with you. You are knowledgeable, you are wise, and I like the education I personally get. You know, I know our viewers are just going to gain so much wealth of information from you. And I'm really hoping that a lot of them will come into your practice and let you be their doctor.
I'm all for that.
I know. I think, I've got to get my dad over to you. That is my next step.
We'll get him figured out.
Yeah, I got to get my dad over to you because he would just love you. So today I kind of wanted to dive into, I got a little personal there. I wanted to kind of dive into some diabetes prevention. And so I guess my biggest thing today would be to start with, how can someone prevent from being a diabetic?
I think that's a great question. A lot of people think, oh, mom got diabetes, so I'm going to get diabetes. Grandma had diabetes, so I'm going to get diabetes. So unfortunately, most of it's not genetic, especially type 2 diabetes. It's really lifestyle. So we copy mom's lifestyle, because if mom made cookies all the time, you're more likely to make cookies all the time. And if you ate late at night and you don't sleep and all those things. So many of these things, when you intervene on it, it's amazing. As a matter of fact, personally, my mom's side of the family, they were all like fast living, drinking, playing cards until midnight, eating cookies and, having 4 meals at Thanksgiving, that kind of thing. And they all had diabetes. All my uncles died in their early 50s, late 40s on her side. I'm like, oh my gosh. And I'm following all the ADA's recommended diet. I'm like, I know what I'm doing. And I was pre-diabetic at the time. And my sugars were high. And I thought, what am I going to do? Like, I'm doing the right stuff and it's not working. Well, it turns out sometimes what we think is the right stuff is not the right stuff.
Yeah.
And so it's not a foregone conclusion when we see our moms struggling with dementia and Parkinson's and you think, there's nothing I can do. There's a lot we can do in prevention. And diabetes is the most preventable disease I think we have.
Really?
Because we have 18 years to predict that it's coming. It doesn't just happen one day, type 2 diabetes. It's a buildup where your insulin creeps up and your body stops listening to your pancreas and your pancreas tries to force the issue. And if we pay attention to that and we see that insulin going up year after year, think at some point your pancreas cannot make enough insulin and then boom, you have type 2 diabetes. But it's so preventable because if you change what you're doing, we can reverse that. It's not irreversible. And so even when people have diabetes, if we intervene, we can help. So it's not just saying, oh, I have diabetes, so I'm just going to shoot insulin the rest of my life.
You just said change what you're doing. What do you mean?
Change what you're doing. Watch your stress level. Get your sleep.
Gotcha.
Don't take in a bunch of processed food and sugars and, just making those little changes. And one of the biggest things that people don't realize is the impact of exercise, specifically muscle building exercise in our seniors. We have tons of data now that seniors who start lifting weights or doing bands or doing slow exercise where they don't hurt themselves can reverse diabetes. Mostly through exercise, because it's another place to store that extra sugar, right? And if you burn it, the thing we talked about glycogen on our last episode, and glycogen is a storage form of sugar, but you also store a lot of sugar in your liver. That's your primary place of storing it. So muscles, once glycogen, which is stored sugar in the muscle, it has to be burned through exercise, activity of the muscles. So otherwise it just sits there. It doesn't go backwards into the bloodstream again. So it's committed once it goes to the muscles. So if you have no muscle, you don't have very much place to store your glycogen.
Right.
As you put on more muscle mass, you have a lot of place to store sugar. Instead of putting it in the liver where it's causing inflammation and diabetes, people with muscle mass can get away with a lot more than people who don't have muscle mass. So sedentary people, and it's a misnomer that as we get older, where we get diabetes, we get all these health problems. It's if people who are active and fit. I was just out on my mountain bike this morning. I saw a guy, he had to be in his early 90s out doing his thing, right? Nice. Looked great, waved and looked fantastic. Like, wow, that's what I want to do.
Wow.
But this guy's out, he gets it. He's out exercising. He's having, doing his activities. And he has way more muscle mass than most 90-year-olds. And as a result, he's not sitting in a nursing home. Right. And so he's taking care of his health and, enjoying the day and looking at the birds and maybe see a deer run by, getting out and enjoying life is really critical as we get older. So seniors who have more muscle mass live longer. The data is clear on that. It's one of the biggest indicators of longevity is muscle mass. Because the more muscle mass you have, the lower your insulin, the lower your cholesterol generally is.
Because it just goes to your muscles.
And also stress reduction and increasing blood flow to the brain. There's so many factors involved with exercise. If we could just do 15 or 20 minutes here and there, you don't have to go, sweat at the gym if you hate it.
Right. Even if it's like someone just sitting at home, so you have like 2 little weights, right? Like little 1 pound weights.
Yeah, and 1 pound weights. Yeah.
And then like they even sell these like foot pedaler things. Say you're someone with diabetes. Got one from my grandma. Mm-hmm. And she puts her feet in it and it helps her pedal because she had knee replacement. Loves it. I mean, there's so many things that you can do. And I know you're fine.
It's incredible. My brother, I was just teasing him this morning, but I'm like, I'm proud of you. It's so great. He's 9 years older than me. So he's around 65. And he's doing water aerobics. He goes, I'm the only guy. And some lady said, hey, you should do water aerobics. He goes, okay. So he's in there. He said, that's harder than you think. He's running in place and you got these weights that are resistant in the water. He said, I was exhausted after that.
I bet.
But he's feeling great. And he goes, oh my gosh, my mood is better. My mental clarity, all those things. Just getting in the pool, walking in the pool against resistance. Anything you can do is so important.
Right.
It really makes a difference. Yeah.
I like aquatic exercising.
Yeah, a lot of people do.
I really don't. I like swimming.
But some people do paddle boarding or swimming,
yeah.
or just finding what you enjoy. Hiking, a lot of people are rucking now with some extra weights on them and building that muscle. Helps prevent osteoporosis. All these other things we worry about as we get older. There's so many benefits. So yeah, just
so that'll prevent osteoporosis.
Even bouncing on a little, those little trampolines like Richard Simmons, like those things. There's definite solid data on that. With NASA was studying it for astronauts when they came back from space, that their sugars improved, everything got better bouncing on that. And there's crazy
from the trampoline.
Yeah, trampoline, the little tiny trampolines, not jumping and doing flips like the kids, just a little one walking in place. It's incredible. There's a little muscle called the soleus muscle. There's something called, people can look it up, a soleus push-up, where they're studying it at huge institutions now. This little muscle soaks up sugar like crazy. And it's a tiny little muscle right underneath your calf muscle. And all they do is raise their heels up and put it down. Raise their heels up and put it down. And they watch the sugars go down while they're doing this. So trampolining is it's monopolizing on those same muscles without getting all the trauma to the body.
So you can just do like your calf workouts, right? And watch that sugar go down?
Absolutely, you can. And my patients with continuous glucose monitors after dinner, my diabetics who go for little 5-minute, 10-minute walks, their sugars come straight down with that.
That is
because
amazing.
The muscles are burning that sugar out of your bloodstream, right? And it's irreversible. It's not going back.
That's amazing.
So if you sit there and do nothing, even there's data showing that if you do squats before you eat dinner, that the sugars don't go up as much afterwards because your thigh muscles are very strong and they soak up sugar while you're eating. Instead of storing it in your fat, you're storing it in your muscle because you just depleted it. And it sounds silly, but there's tons of data out there.
That's crazy.
So diabetics, there's ways to manage it without, working out for 4 hours at the gym every day.
Right. Yeah. So there's all kinds of alternatives we can do instead of like if we don't want to go to the gym.
Yeah, there's people that will, when they're on business calls, they just walk around the office. A lot of us have standing desks, or you could be on a call and just squat against the wall. Your legs will feel that after a few seconds, and you can carry on a conversation, do business, do whatever you're doing. So a good friend of mine, he got himself in good shape just during his business meeting. He was saying, instead of sitting in my office, let's walk around and talk. And it builds relationship with people too.
Oh, yeah.
Because you can go to the lake and walk around the lake and talk about this business deal you're doing, and you're not stuck in a sterile environment. Absolutely. So I love it. I actually go on hikes with my patients too.
Do you?
Yeah. We get together and go, hey, you got me for an hour. Let's hike and walk and ask me questions.
I love it.
I'm out there. We're exercising together and it's fantastic. It's great.
Look at this. A doctor that comes out of the office and goes on hikes with you.
Yeah, because I need the exercise too. And if I'm going to be talking to you, I can be sitting like this, or we can go walk and hike. Maybe our next podcast we can do that.
I would love that. We'll be
at Watson Lake. And
I would love that. We gotta go on a hike. Okay, I'm game.
All right.
I'm game. I really want to direct some of our viewers to your website. Your website is beautiful. You have a new website.
Yeah, I love it. ArizonaMetabolic Health.com.
Perfect.
all one word. And so, yeah, I love it. I have resources on there, like things I recommend where people, I talk to the manufacturers, like, hey, we give my patients a discount. So a lot of the product, it's all products that I believe in or that I personally use with my patients. And so it's great. A lot of resources for nutrition, vitamins, like things like that. And obviously on the website, we have, podcasts that I've done or interviews that I've done over the years. So there's a lot of great resources there.
And that's where people can find Life's Good Medicine and Low Carb MD.
Yeah, Life's Best Medicine, Low Carb MD, and other interviews I've done over time. And, some of the ones we've done are on there, if they missed out. So, yeah, I think it's just great where you can go and listen and kind of get an idea of what I stand for, what I believe in medicine. And so, it's hard to find a new doctor. And so just saying, are we aligned? And it's important for me, too, because I want people who are saying, look, I want to invest in my health. I want to grow old and enjoy life and do well. And I don't want to just have a bunch of drugs thrown at me. And so it's amazing. And I do have a prescription pad. I try not to use it
I remember
as much, I mean, it's funny because people say, well, do you write any prescription? I do. And sometimes we need that. I'm a Western trained doc. But I've realized there's so many things that we can do that you don't need the prescription pad.
I remember the first time I met you, you said, I think it was one of your commercials at our networking group, and you said, yes, I do write prescriptions. And it just caught me off guard. So, because you don't hear that. You don't hear a doctor say that,
Yeah, it's funny. I mean, because a lot of people say, they'll say, I didn't think about asking you for, I had a sinus infection. I didn't think about asking you. I was like, this is what I do too, right? But we try to minimize antibiotic use if we can. And there's times where it's appropriate and sometimes it's overused, and there's risk and benefits to everything we do. And you say, well, let's minimize the risk.
Right. I love it. Oh, so now you got me thinking about where we're going to go on a hike for our next podcast.
Yeah,
we'll have to get our producer out there and everything
with
us.
That'll be fun.
It just some good fresh air. It'd be great. Before we wrap up, I really want our viewers to understand why you're such a good fit for this community.
I love this community. I love San Diego, which isn't a bad community also. But when I came here, I realized, I talked to my neighbor. I said, what's the worst thing about living here? What's the best thing? And they said, hard to get good medical care. And when I hear that, it's devastating. In San Diego now, it's devastating because to get into an oncologist now is a 6-month wait. To see a cardiologist, at least 3 months wait. And you start realizing, it's hard that people have to go down to Phoenix or up to Flag to get good medical care. I was like, I can treat most of those things. It just takes time. We have to get to know each other. And I love the community here where we maybe politically, spiritually, whatever, there's a connection that I've had with people here that's amazing, and say, hey, look, we all believe in medical freedom. We agree on that you want to make your own informed decisions. And a lot of people, unfortunately, that I talk to, they feel like their doctors, they have to have a confrontation with their doctor all the time because the one number may be off a little bit and they don't want to take a certain drug, whatever it may be. My job is to look at the risk and benefit and discuss that with you. And then you make your decision. I help you make an informed consent decision.
Right.
And in medicine over the last few years, some people lost their rights a lot of times, where doctors just said, look, you're going to get this or you're not going to be in my practice. And so, I never believed in that, and it's not ethical. And so when we look at medical ethics, we violated those things over the years. And here people are seem to be on track with what I'm talking about and saying, I don't want just a drug for everything. What can I do to be healthier? How can I educate myself? We're giving a talk on a brain boot camp coming up, and it's a free talk.
When and where is that?
Yeah, it's at Yavapai College on September 6th, but it's already full. Free talk, and it was filled up 2 weeks ago. Wow, it's amazing.
Is it going to be streamed anywhere?
It's not going to be streamed this time, but I think we're going to do some encores and have more. And Jen Best, who's doing a lot with the brain part of this, and we're really aligned. And we're going to do a bunch of talks together coming up because I really want to be in the community. So anyone wants me to speak, I'll come and do it. I would love to for any group, because I think getting the word out and doing question and answer and answering the hard questions where I stand on things. I think that's, as a doctor, I think we owe that to our patients.
Oh, yeah.
So a lot of doctors get upset if a patient brings in a study they read or asks questions about things. And we can say, yeah, that's a good study, or no, it's not, or I don't know anything about it. Let me take that home and look at it.
I think you're one of the most genuinely honest and open doctors I have ever met.
Yeah, I think there's more coming up.
I mean that in a good way.
Yeah, I think it's so important. I think it's so important. Really, if you're going to someone for, remodeling your kitchen.
Right.
You want the best person who knows what
Absolutely.
they're talking about and saying, hey, I'm not here to rip you off. I want to do the best thing for you.
Right.
And so having expertise in certain areas is beneficial. Or if you don't know, say, I'm not the expert in that area, go see this person who's better at that. And I think it takes humility in medicine, but also confidence in knowing what you're talking about and clinical experience.
Right.
So I think the more I'm around, the more I feel confident. If someone 10 years ago, if someone came to me with diabetes, it was a stress for me because I knew it was coming. The amputations, dialysis, blindness, all these things. Now I say, oh, let's do this. If you're in, I'm in. We got this, right? So it's so great to be able to say, I've done this remodel 1,000 times. We could do your remodel easy. I know how to do it.
Right.
Not, this is the first time I'm just trying to figure this out. And, so I think that's what's so great about this community. People are really wanting to live long, healthy lives. They retire to a beautiful place and they want to enjoy it.
Make changes.
Say, hey, I'll make some changes if it's going to help me to not end up in a nursing home.
Right.
I think hospice. It's so important on hospice. Yeah. And the system's overwhelmed. So if we make people healthier, right, it's just so much better for everyone.
Makes our whole community better, healthier.
Yeah, because there's so many people, and I look at even in church, people who may have a great ministry, but they can't get out in the community because they weigh 400 pounds. Like, man, I would love to help that person so they can go do what they want to do. Spread the word or do whatever you want to do. And so some people like fishing and they can't go out because it's so hard to get going. And it's like, wow, that would be nice to give them that, right? And that's going to help their health way more than any drug I can give you.
Absolutely.
So I think the more you're around, the more you realize it's so great to see people thriving, right? Not just surviving.
Oh, absolutely.
And so, that's what's important, as I get older, it's more important to me too. Say, okay, what can I do? So I want to educate myself and say, how can I be the healthiest I can be and not be a burden to my kids and really enjoy life and, not have to go watch my wife go on vacation while I'm sitting at home because I can't go. So I've seen that, I've been to on vacation where I see someone who they're in a wheelchair and they can't go enjoy what the family's doing. And it's devastating. I think, gosh, if we can intervene, that would be amazing to see.
Before it gets to that point.
Yeah. And the whole thing is preventive medicine.
Right.
And we have it. There's so much education, but I'll tell you, fasting insulin, I think is the most critical test we can get. Like to really know where someone's at metabolically. It costs about $12 to get the test. 98% of doctors won't order it because they don't know what it means. They don't understand the significance because this is such a new and upcoming area of medicine, but the doctors who get it are doing miracles. And so, so many of these things, like you said, it's easier to prevent it than to treat it. So if we can, like I say, it's like you'd rather change your oil than blow up your engine and have the best person who's going to replace your engine.
Right.
That's way more work than changing the oil and making sure your car's running. I want my mechanic to say, here's what you need to do to keep your car running, not say, when it blows up, we can fix it.
Yeah, not, I'm so sorry that this happened, but this is what we could have done.
Yeah, exactly.
You don't want to have to go through end up on the side of the road and all of a sudden you've got oil spitting out everywhere.
Yeah, in a car we can get a new one, but
translate
our body,
that
we
to
can't.
your body and go, well, I don't want to be spitting anything out of my body. You know what I mean?
Yeah.
And so I feel like having you on the podcast is just so important. Just I want people to understand just how passionate you are and how knowledgeable and just how much Arizona Metabolic Health is really going to help the community.
I love it. And really for me, it's word of mouth, right? You get patients and I go month to month. So if I'm not doing my job, fire me, right? That's how I feel. It's like, if we're doing a good job, you don't need to sign into a 2-year contract. Yep. You say month to month, if I'm not doing my job, say, okay, move on. I haven't had that happen, but not locking people in because you don't want to have someone hostage to you and say, if you want your medicines, you got to do these things. So I think, trying to get people off medicines and make them independent. And for me, it's upfront cost, right? So I can invest that time, sit with an hour with someone and get you on the right track where you don't need me as much in the long run. So it helps both of us. I can go hiking in the morning and ride my mountain bike and not have sick people, but, obviously some illnesses are, you're going to fall off your bike and hurt yourself. Those kind of things are going to happen. But 95% of what we're treating is self-imposed.
Right.
Unfortunately.
So you're the doctor that say it's Friday at 5:00. I have a sinus infection. I can call you or text you and you call me or text me back. How is that even real?
I'm so glad you brought that up because we had some friends over for dinner. There were 6 of us together, 2 other couples. And I said, I'll be right back. I'm so sorry. I'll be right back. And I went in and a patient had an emergency and I had to just take care of it. It took 10 minutes and sent her in her meds. And they go, what were you doing? I said, I was calling one of my patients. And they all looked at each other dumbfounded. Here in Prescott, they were dumbfounded. They said, you call your patient on Saturday night, like at 6 o'clock? I said, yeah, that's what I do. Right. And they were like, oh my gosh, they had all been to urgent care in the last year because their doctor wouldn't call them back with a urinary infection or a sinus infection, something like that. So simple. It takes me 3 minutes of my life.
So miserable.
And most patients are very respectful and they try to call me before that time. But, a lot of times people call me and they have an emergency and later at night, if it happens, and they apologize. I say, this is what you paid for. Right. This is what I'm supposed to do. I'm doing my job. Right. And so that's the problem. A lot of times doctors aren't reachable. Like people, I hear it all the time. They call their doctor 6, 7, 8 times. That's malpractice. You have to call your patients back, right? If you have an emergency, I'm there to take care of you. That's my job. And so by limiting my practice, I'm available for that, and you shouldn't have to go to urgent care. You shouldn't have to go to the emergency room for a minor, and our emergency rooms are already overflowing with people. Bad. And so if the doctors do their job, if they're not overwhelmed, then they can do that. But I have sympathy for that because I know I had 2,400 patients in my old practice, my standard medicine practice. Then I went down to 500 patients. So I could provide a lot more services and time. And, but you think if you have, the average doctor has over 2,000 patients they're responsible for. And you think about it and you think, even if you're just doing physicals, you're doing 6 physicals a day just to see your patients. Then you have sick people and all these other problems. You're not just doing physicals. So the medical system's overrun, and I think we have to fix it, because the doctors are dying off and getting sick too, because the stress is unbelievable. The burnout rate in physicians is incredible. So a lot of my friends are calling me like, how are you not burned out? I say, I love it. I love what I do. Because I can call you back at 6 o'clock and take care of you and then still go and be with my friends for a while, And so, having the accessibility, a lot of people don't realize there's a difference between having insurance and having healthcare.
Yes.
So if you can't get access, if everyone has a ticket to the bus for free, but there's only one bus, it's going to take you forever to get on there. And that's the dilemma a lot of doctors face. How do I spend time with the patient in front of me, but I have 30 people waiting that I have to see? And it's a struggle. And I struggle with that, trying to be more efficient. Now it's like, my patient's like, hey, doc, I got to go. I have a meeting. And we're talking, I go, you still got 15 minutes left. If you want, I got time, So it's amazing. And like today, I had a patient that was new that had a lot of health problems and I had all the time in the world. Like he's like, you're not going to rush me out. And I said, no, let's finish up. No hurry. Because no one wants to come to their doctors and be stressed out.
No.
And so we're supposed to be a calming environment and help you figure it out. And you can't do that in 10 minutes. It ain't going to happen no matter how good of a doctor you are.
No, especially when you're trying to learn someone's, as you say, metabolic health and help them restructure how to get it back to where it should be.
Yes, the education. And it's upfront cost, right, for me. Because I'm betting if I get you on track, then you're not going to need me as much. And so it works out great. So I have a lot of people, they just come in for their annual exams and I'm doing great. Everything's good, doc. I just talk about the kids and what's happening in life, what changed since we saw each other last time. And I have some people I need to see, every couple of weeks and we make sure we get them squared away. Right. And so with time, they'll get healthier. And then I come to the next person who needs a lot more help. So it's amazing. It's amazing that what we can do, but we can't be overwhelmed with sick people everywhere.
Right.
You can't help everyone when it's like that,
but
it's amazing. And plus what I do is every 2 weeks with my patients, we have a Zoom meeting. And so patients help each other. They go, yeah, I was eating too much sugar at night. Here's what I did. And it worked for me. And people say, wow, that helped me. And then 2 weeks later, they say, thank you so much. That helped me. And it helped me get through. And so I can shut up and just sit there and moderate and let my patients help each other. And it's incredible to see, especially if you have diabetes and you see 6 people here who are off insulin now. You think, okay, there's hope. Now, when we give people hope, they can do so much, so much. But if I tell you have a chronic disease, I can't help you, then that's not a very good message. And it's not the truth.
You know what I call that, where it's people or your patients are helping patients? I call that community.
It's community.
It is community.
And I'll tell you, that's what I love about Prescott too. Yeah. It's a community and people serve each other and help each other and volunteer and do things. And that's what these patients love it. If they reverse their diabetes, they want to help that next person.
I love it.
So they're invested in you getting better, and it's so great to see. Community is so critical. And I think during the lockdowns, we realized I watched seniors decline dramatically, mentally, physically, emotionally. Diabetes getting out of control because they couldn't look at someone's face or see someone smile or hold their hand or get a hug. They would knock on the door and say, wait 30 seconds, get your food and get back in your room, in some of these facilities. And that's why Hal, who I mentioned on the previous, they were out playing catch in the backyard, they're all sequestered together anyways. They're all together all the time.
Right.
Why can't you go in the backyard and enjoy some sunshine and laugh and play games and do stuff? And he had 0 mortality rate. So people need to listen to what works and how to keep your people healthier.
Absolutely. I agree. Well, I'm going to go ahead and wrap us up for today.
All right.
Again, just thank you for being here. Thank you for coming in. Always a pleasure. And you're teaching, I love that everyone's getting to hear this and see just how amazing you are and just how much they need to come in and take you on as their new patient, Yeah.
And I'm selective in that. I want people who really, because I want people to get their money's worth, right? And if you're not willing to make some lifestyle changes and say, I'm not just going to be dependent on meds, you can go anywhere and get that kind of medicine. Right. Really, I'm looking for the patient to say, look, I want to be healthy. I want to invest. I'll bring my husband with me. Let's sit down and talk, whatever we can do to get healthier. That is amazing to see because we can do it together. It's just really, we both have to be invested. Absolutely. I can't be invested more than you are, and you can't be invested more than I am. And so to see that is just so much fun, especially just seeing patients leave with hope and say, I can do something about this. Instead of saying, well, it's out of your control, it's genetic.
Gave me goosebumps again.
But thank you so much for having me. It's great. I only get invited one time usually, so to get invited back is kind of a special thing. I'm kidding, but thank you.
You are always welcome here. I will always welcome you. Always. The door is always open.
Thank you so much.
So I guess our next episode will be at one of the lakes.
All right.
On a hike.
If I can talk everyone else into it.
All right.
We can get our cameras out there.
All right. I'm Megan McClennahan. Again, this is Dr. Brian Lenzkes from AZ Metabolic Health. Truly go check out his practice, give him a call, go to the website, check out our next podcast. Thank you for joining us.